Who'd have thought that we'd all be sitting around talking about moderate to severe plaque psoriasis? I'm so excited to be part of this, and I'm so grateful for all three of us getting together.
I'm so touched that you've been so open and honest about sharing your history and experience with psoriasis so that other patients can be empowered to do the same thing.
Yeah. Talking about plaque psoriasis is not something that I thought I would be doing ever. It was something that you hid. You know, I got it when I was 25. People would say, oh, you're so mellow and seem so relaxed. And I'd go, thank you. Hiding the fact that I was, you know, a nervous wreck.
As someone who's never had to hide anything about myself and feels confident every moment of my life, like, I'm really learning a lot from this.
Mindy, I was so happy to hear that you were going to be part of this. And then my next question was, wait a minute, why? You know, you don't have psoriasis.
Well, I'm a huge Ted Danson fan.
That was it. That's all.
That's
anyway.
it. The truth is, I don't have plaque psoriasis. Don't throw me out.
Yeah, I won't.
But I think it's really important to be an advocate and an ally. I did not know much about plaque psoriasis, but for me, it was really important to show that allyship can come from anywhere. And so I just feel really honored to listen to your story and learn from you.
Dr. Song, why are you here?
I'm here to share the perspective from a dermatologist. I treat many patients with plaque psoriasis, and I really want to help them find the right treatment and understand their challenges.
One of the things that we talk about with this campaign is that we encourage people to be an advocate for themselves. You need to have a relationship with your dermatologist. So what does that mean to you?
I think that means for patients coming into your doctor's visits ready with questions, and then telling your doctor what your goals are. What do you want to accomplish in your treatment for psoriasis?
Yeah, it is a real partnership.
What's so amazing now is you have more treatment options than ever. Today, we're here to talk about Sotyktu, which is an FDA-approved once-daily oral option for adults with moderate to severe plaque psoriasis.
This campaign is pretty cool. And the whole message of become your own advocate and get out there and there's hope. It's such a wonderful thing to put out in the world. I used to say when I was younger, life is short, going, hey, hey, hey. Not really, because I'm immortal. But at 76, I'm going, yeah, life is short. Why are you holding back anything that can't possibly nurture yourself or others?
That's a beautiful thing.
I'm a beautiful guy. Thank you. I really appreciate that you're here, Mindy.
Listen, it's hard to feel comfortable in your skin no matter what you're dealing with or what you're living with. And I like to learn and like to know about things so I can be a better friend and family member.
I think it's a powerful message coming from both of you who are such public figures. Other patients can be empowered to do the same thing. Yeah. Share their stories, not feel so isolated, and find a doctor so they can openly talk about their psoriasis and find the right treatments for them.
Thank you, and I really appreciate being part of this conversation.
Indication. Sotyktu, deucravacitinib, is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy. It is not known if Sotyktu is safe and effective in children under 18 years of age. Important safety information about Sotyktu, deucravacitinib. Sotyktu may cause serious side effects, including serious allergic reactions. Stop taking Sotyktu and get emergency medical help right away if you develop any of the following symptoms of a serious allergic reaction. Feel faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives. Infections. Sotyktu is a medicine that affects your immune system. Sotyktu can lower the ability of your immune system to fight infections and can increase your risk of infections. Some people have had serious infections while taking Sotyktu, such as infections of the lungs, including pneumonia and tuberculosis, TB, and COVID-19. Your healthcare provider should check you for infections and TB before starting treatment with Sotyktu and watch you closely for signs and symptoms of TB during Sotyktu treatment. You may be treated for TB before you begin Sotyktu treatment if you have a history of TB or have active TB. If you get a serious infection, your healthcare provider may tell you to stop taking Sotyktu until your infection is controlled. So TIC2 should not be used in people with an active, serious infection, including localized infections. You should not start taking Sotyktu if you have any kind of infection unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster. Before starting Sotyktu, tell your healthcare provider if you are being treated for an infection or have had an infection that does not go away or keeps coming back. Have TB or have been in close contact with someone with TB. Have or have had hepatitis B or C. Think you have an infection or have symptoms of an infection such as fever, sweats or chills, muscle aches, weight loss, cough, shortness of breath, blood in your phlegm, mucus, warm, red, or painful skin or sores on your body different from your psoriasis, diarrhea or stomach pain, burning when you urinate or urinating more often than normal, feeling very tired. After you start taking Sotyktu, call your healthcare provider right away if you have an infection or have symptoms of an infection. Sotyktu can make you more likely to get infections or make any infections you have worse. Cancer. Certain kinds of cancer, including lymphoma, have been reported in people taking Sotyktu. Tell your healthcare provider if you have ever had any type of cancer. Muscle problems, rhabdomyolysis. Sotyktu can cause muscle problems that can be severe. Treatment with Sotyktu may increase the level of an enzyme in your blood called creatine phosphokinase, CPK, and can be a sign of muscle damage. Increased CPK is common in people taking Sotyktu. Your healthcare provider may tell you to stop taking Sotyktu if the amount of CPK in your blood gets too high, or if you have signs and symptoms of severe muscle problems. Tell your healthcare provider right away if you have any of these signs or symptoms of severe muscle problems. Unexplained muscle pain, tenderness or weakness, feeling very tired, fever, or dark-colored urine. Do not take Sotyktu if you are allergic to deucravacitinib or any of the ingredients in Sotyktu. Before taking Sotyktu, tell your healthcare provider about all of your medical conditions, including if you have liver problems or kidney problems, have high levels of fat in your blood, triglycerides, or have recently received or are scheduled to receive an immunization, vaccine, as you should avoid receiving live vaccines during treatment with Sotyktu. Tell your healthcare provider if you are pregnant, plan to become pregnant, or if you are breastfeeding or plan to breastfeed. It is not known if Sotyktu can harm your unborn baby or if Sotyktu passes into your breast milk. Report pregnancies to the Bristol Myers Squibb Company's Adverse Event Reporting Line at 1-800-721-5072. Tell your healthcare provider about all the medicines you take, including prescription medicines, over-the-counter medicines, vitamins, and herbal supplements. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. Take Sotyktu exactly as your healthcare provider tells you to take it. Take Sotyktu one time every day with or without food. Do not crush, cut, or chew the Sotyktu tablets. Sotyktu may cause serious side effects, including changes in certain laboratory test results. Changes in laboratory tests have happened in some people taking Sotyktu. Your healthcare provider may do blood tests before you start taking Sotyktu and during treatment with Sotyktu to check for the following: increased triglycerides. Too much fat in your blood can cause problems with your heart. Increased liver enzymes. If your liver enzymes increase too much, your healthcare provider may need to do additional tests on your liver and may tell you to stop taking Sotyktu if they think that Sotyktu is harming your liver. Potential risks from Janus kinase, JAK inhibition. Sotyktu is a tyrosine kinase 2, TYK2 inhibitor. TYK2 is in the JAK family. It is not known whether taking Sotyktu has the same risks as taking JAK inhibitors. Increased risk of death, all causes, has happened in people who are 50 years of age and older with at least one heart disease, cardiovascular risk factor, who were taking a JAK inhibitor used to treat rheumatoid arthritis, RA, compared to people taking another medicine in a class of medicines called TNF blockers. Sotyktu is not for use in people with RA. The most common side effects of Sotyktu include common cold, sore throat and sinus infection, upper respiratory infections, cold sores, herpes simplex, sores on inner lips, gums, tongue, or roof of the mouth, canker sores, inflamed hair pores, folliculitis, and acne. These are not all of the possible side effects of Sotyktu. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see U.S. full prescribing information, including the medication guide for Sotyktu.
That's why we're here today to talk more about plaque psoriasis.
Dr. Song, you are killing segues.
I was just going to say,
You are
that's
masterful.
why you're here. Woof.